Hello, my name is Spring, and for RRA2, I chose this article, The Relationship Between Serum Concentration of Vitamin D, Total Intracranial Volume, and Severity of Depressive Symptoms in Patients with Major Depressive Disorder. The authors of the study are on the slide, and I chose this article because I work with people with mental health disorders like MDD, and I've heard there's a link between low vitamin D levels and depression, but I wasn't sure if this relationship was due to correlation or causation, or if there was even a clear trend there. And while nutrition plays a role in many processes, it also makes sense that people with milder depressive symptoms, they may spend more time outdoors, therefore naturally increasing their vitamin D levels, whereas those experience more severe mood symptoms may spend more time indoors. Purpose, or what this study is about. Depression is a mental disorder that affects quality of life, and previous studies have suggested that there's a link between vitamin D deficiency and depression. In the study, researchers wanted to evaluate the relationship between serum vitamin D levels, total intracranial volume, or TIV, and depression severity in people with major depressive disorder. Researchers hypothesized that TIV would mediate the relationship between serum vitamin D concentration and severity of depressive symptoms. Real quick, I just wanted to go over some definitions. Serum concentration of vitamin D, or SCVD, is used to determine vitamin D levels in the body just through a blood test. And total intracranial volume, or TIV, is the total volume of space inside the skull encompassing the brain, cerebrospinal fluid, and meninges. Simply put, TIV is your brain volume, and in general, a higher TIV is good. You want more brain volume. So with that said, we'll move on to the methodology. Methodology. 50 patients were recruited from the outpatient and inpatient departments of Huffay Fourth People's Hospital. The severity of depression symptoms were measured using the Hamilton Rating Scale for Depression, or HAMD. An MRI was used to measure TIV, and blood tests were used to measure vitamin D levels. Psychiatrists confirmed the diagnosis of depression, and patients received their regular antidepressant medications. Methodology for the MRIs. Image processing was performed using statistical parametric mapping software, and TIV was calculated as the sum of gray matter, white matter, and cerebrospinal fluid volumes. And during the MRI, patients were instructed to keep their eyes closed, to relax but not fall asleep, think of nothing specifically, and move as little as possible. Methodology for serum vitamin D. Patients fasted overnight. A small sample, about 2 milliliters of blood, was collected the morning of the MRI, and blood samples were immediately sent to be centrifuged in the hospital lab. Type of analysis. Data was analyzed through correlation, linear regression, and mediation methods. Mediation methods refer to statistical techniques used to analyze how a third variable, called a mediator, explains the relationship between x and y. Statistical analysis were performed using software, two kinds. One's process macro and the other is SPSS 23.0. Correlation was used to examine the relationships between TIV, vitamin D levels, and HAMD score. And finally, linear regression was used to assess how well vitamin D levels and TIV predict the HAMD score. This is a table showing demographic and clinical characteristics of the sample. So 62% of participants were female. The mean age was 42.1 years. And serum concentration of vitamin D was 44.37 nanomoles per liter. We'll talk more about this later, but among the 45 patients, which there are 50 in the study, but they only got a sample for 45, 15 were classified as insufficiency and 30 were classified as vitamin D deficient. Next, we'll get into the results. This is a scatter plot of the association between TIV and HAMD. In general, the higher the HAMD score, the more severe the depression. The score levels are as follows. 0 to 7 is no depression, 8 to 16 is mild depression, 17 to 23 is moderate depression, 24 and above is severe depression. And of course, everyone in this study has MDD. Now with this, we can see that this is a negative correlation. That is, the higher the HAMD score, the more severe the depression, as well as the lower total intracranial volume. Results continued. This is a scatter plot of the association between serum concentration of vitamin D and HAMD score. Now, just for information, a normal level of vitamin D in our body is 75 to 250 nanomoles per liter. So you will see no one in the study meets that threshold. What this line of best fit shows us is that the lower the vitamin D level, the more severe the depression. And this, again, is a negative correlation. This is the last scatter plot that we'll review, and is the association between serum concentration of vitamin D and total intracranial volume. The line of best fit shows us there is a positive correlation here, and the results show that lower vitamin D levels were linked to smaller total intracranial volume. In conclusion, total intracranial volume could be a potential biomarker to monitor vitamin D as an additional treatment in people with major depressive disorder. Of course, vitamin D would not be a primary treatment for that disorder. And it's still unclear if vitamin D, whether derived from supplements or sun exposure, can help treat depression, although higher levels tend to correlate with better mood symptoms, as we saw in the study. Reflection. One thing that I noticed was all participants in the study were vitamin D insufficient or deficient. So since those vitamin D levels were unknown before lab collection, it'd be helpful to compare the TIV and HAMD scores in people who are not deficient. Moreover, it would be interesting to take those same participants and supplement them with vitamin D and kind of monitor those scores as their vitamin D levels improve. Finally, including a survey on the participants' estimated sun exposure could provide additional context, though it may not significantly impact the study's overall findings. So that is the end, and thank you for watching.